I think the relationship between Houston Methodist and the Houston Ballet is very important, and I think it's a relationship that's important to the city of Houston. You have sort of two really iconic institutions within the city that I think mutually benefit from this relationship. It's very rewarding to be able to take care of dancers at the Houston Ballet. I've been very fortunate in my career to take care of many different athletes across the city, and so I love both the arts and I love athletics. And taking care of the ballet dancers is where you get to combine both incredible performing artists with incredible athleticism.
The medical staff, the doctors, the athletic trainers really build this innate understanding of what dancers do and the challenges that they put on their bodies. Having this relationship where there's huge confidence from the artists of the company to know that they have somebody looking after them, looking after their career, keeping them on stage in top form means extra years, seasons that they're going to be able to continue their craft and delight Houston audiences.
Houston Methodist was able to get me back on stage because they fixed my foot. I was experiencing pain in my left foot, and what I thought was just normal aches and pains of being a dancer ended up being something a lot more serious. And through the help of Methodist, we were able to figure out what it was and then how to fix it.
As ballet dancers, our job depends on our full body health, so it's so important for us to see doctors who know the ins and outs and the expectation of our career. Houston Methodist has been such a huge part of my recovery. I went through surgery, and with the physicians and physical therapists, I was able to set a goal and return not only as strong as before, but even stronger. Having Houston Methodist athletic trainers and physicians on site is so helpful because it keeps us from having little minor aches and pains from becoming big injuries, and also it just adds so much value to the company.
As an athletic trainer, I have the privilege of journeying alongside these dancers from the time of their injury all the way back to their return to stage. And that involves injury evaluation, developing a plan for managing pain and swelling, designing an appropriate rehab program for them, as well as using other tools that we have in the clinic to address any tightnesses or weaknesses or imbalances that develop from their injury. And then lastly, layering on the technical ability that they need to perform at the high level of intensity that they do on stage.
Since I've been taking care of the ballet for 20 plus years, with the partners and with our department as it's expanded over the same time frame, we've done a lot of research. We've done some really groundbreaking studies on injury prevention programs for dancers. We've looked at genetic factors that might be important in dancers from a flexibility standpoint, since a lot of dancers have tremendous flexibility.
A dancer becomes injured, there's a lot of fear that comes with that, and there's a lot of anxiety and stress and fear of the unknown. And I feel like Methodist was with me every step of the way of really guiding me and comforting me and assuring that I was going to come out on the other side a stronger and better dancer. And so I'm just forever grateful for the doctors and the team at Methodist for allowing me to come back as the dancer that I always wanted to be.